Hi, I'm Paul. I'm one of the nurse practitioners at Anew Med Spa. Today I have Connie. She's scheduled to have some PDO smooth threads placed in her submental region under her chin, and she's also going to have some Sculptra placed in her mid-face. These great products that help with skin tightening, collagen building, and improve the overall look.
Okay, I'm going to go ahead and talk through this, and Paula's going to demonstrate the procedure here because she's got a little bit of a cold, so you're stuck with me no matter what. So Paula's going to draw out her pattern of how she's going to apply these smooth threads here. So go ahead and do that. And really it's going to be in somewhat of a star pattern, and that's exactly what we're looking to accomplish here. And what this is going to do is this crisscross is going to give us a whole area of which we are going to go ahead and be able to build collagen. And as you build collagen underneath this chin, this whole area is going to get tighter and tighter and tighter. So this is an under neck lift, a chin lift. You can use it with things like Kybella, which will get rid of the fat first, and then you can use this afterwards. I mean, a lot of different things, a lot of different therapies that we can go ahead and do. So now she's going to go ahead and demonstrate, and what she's using is a 29 gauge, I think that's a 40, right? A 29 gauge 40 PDO thread that you can get from Stat EDS, and she's going to insert it as we go through here. And you're going to see the first one, you're going to feel a little pinch. She's had some numbing cream on here already. And as you can see, she's just going to go right underneath the skin. And this is in what we call the subdermal plane. And that's what we're looking for as she goes up here. And that thread's going to be left behind. And you can see now it's gone pretty much the entire length of this area here. And she's just going to work her way around. This is a very simple procedure for both doctor, dentists, nurses, whatever kind of healthcare professional you are to get trained on. And it's a great procedure for patients to get because it can be accomplished fairly quickly and it can give a great result. And what's going to happen here is, and I'm going to talk while she's working, so she's managing the patient and managing the procedure while I get to just talk through it. What you're going to see here is literally an immediate visible result that's going to happen right away as it supports this whole area. And then over time, as the solid filler threads start to break down, what we are going to go ahead and see is we are going to see that buildup of collagen, angiogenesis. It's going to rejuvenate the skin, and it's going to really tighten everything up here. And if you need to move, Paula, you can.
I'm okay here.
We'll let you move around to wherever you are because we can move out of your way since you're the one doing this procedure.
Right now I'm okay.
And what you can see is she's got a little bend in the hub, if you notice as she places this. And what that does, it points the needle up and puts it into the right plane. And this is the kind of things that you will learn when you come to an AAFE training course here. And here goes, and this is just a star pattern. The number of threads that go in here really depends on the different, depending on the patient's needs, really. But certainly we want to put in enough threads to go ahead and do the job for the patient here. So you can see while I'm talking through here, she's got a number of these in. She's got a few more to go here, and you'll see her then take them all out. You can put these all in at one time. You can take out one at a time. If you want, put it in, take one out. You can leave them in so you know where you've been. And you can see as she's counting around, making sure that she's got them all in place. And it never hurts to throw in a few more at any given time too, because we want to make sure that we really have got what we need to go ahead and accomplish and get the result that we want and get the result for the patient here. So this is what you do. Once these are in here, there's a little loop at the end of these threads. You turn these 360 degrees. That will go ahead and engage the loop, and then you pull them out. Quicker is better, as you can see Paula demonstrating here as well here. And that is the kind of thing that all of you can go ahead and do in your practice, and you're going to get a beautiful result here too. And it's a fairly comfortable procedure, even though she had a little bit of numbing cream, but you can see this is a quick in and out procedure that's going to give this patient a really great result.